Hey everybody, welcome back to Healthy Mind and Body channel. Today, we're tackling a big one, diabetes. It's a condition that affects millions around the world, and it's something we get asked about a lot. We're going to break down the symptoms you need to watch out for, how to know if you might be at risk, and some simple steps you can take to potentially prevent it. And of course, we'll also dive into some natural remedies that might help manage the condition. The more you understand about your health, the better equipped you are to take control. So, let's get started. All right, let's kick things off by talking about the warning signs. Early detection is key with diabetes, so it's important to know what to look out for. One of the most common symptoms is frequent urination, especially at night. You find yourself waking up multiple times just to go to the bathroom. Now, this can be caused by a lot of things, but if it's happening more often than usual, it's worth investigating. Another telltale sign is excessive thirst, even if you're drinking plenty of fluids. This ties in with the frequent urination. Your body is trying to flush out excess glucose, and that takes water, leaving you feeling dehydrated. Keep an eye out for that constant, unquenchable thirst. Unexplained weight loss is another red flag. You're not dieting, you're not exercising more than usual, but the pounds are dropping off. This can happen because your body isn't able to use glucose for energy as efficiently, so it starts burning fat and muscle for fuel instead. Increased hunger, even after you've eaten a meal, is another symptom to watch out for. Again, this is related to your body's struggle to utilize glucose properly. You might feel like you're constantly hungry because your cells aren't getting the energy they need. Blurry vision is a symptom that can sometimes sneak up on people. High blood sugar can damage the tiny blood vessels in your eyes, which can lead to blurred vision or even vision loss if left untreated. If you notice any sudden changes in your vision, don't ignore it. Slow healing sores or cuts are another potential sign of diabetes. High blood sugar can impair your body's ability to heal, making it harder for wounds to close up and increasing the risk of infection. Feeling tired and fatigued all the time, even after a good night's sleep, can be another indicator. When your body can't use glucose for energy effectively, it can leave you feeling drained and sluggish. Skin problems like frequent yeast infections or itchy skin can also be linked to diabetes. High blood sugar creates an environment where yeast and bacteria thrive, leading to these types of infections. Tingling or numbness in your hands or feet, also known as neuropathy, is another potential complication of diabetes. This happens when high blood sugar damages the nerves in your extremities. Okay, so you've been paying attention to your body, and you're noticing some of the symptoms we just talked about. What's the next step? Well, the most important thing is to get tested. Don't panic, it's a simple blood test that can tell you if your blood sugar levels are in a healthy range. Now, there are a few different types of tests your doctor might recommend. The most common is the fasting blood sugar test, where you fast for 8 hours before the test. This gives a snapshot of your blood sugar levels after a period without food. Another test is the A1C test, which measures your average blood sugar levels over the past 2 to 3 months. This gives a broader picture of your blood sugar control. Your doctor might also suggest an oral glucose tolerance test, which involves drinking a sugary solution and then having your blood sugar levels checked at intervals afterward. These tests are essential in diagnosing diabetes and determining the best course of treatment. Early detection and management are crucial in preventing complications down the line. The American Diabetes Association recommends that everyone over the age of 45 get tested for diabetes at least every 3 years. If you're under 45 but have certain risk factors, like being overweight or obese, having a family history of diabetes, or having high blood pressure, your doctor might recommend getting tested earlier or more frequently. It's also important for women who had gestational diabetes during pregnancy to get tested for diabetes after delivery and then regularly throughout their lives. Talk to your doctor about your risk factors and get tested if necessary. All right, let's talk about food. What you eat plays a huge role in managing and preventing diabetes. It's not about deprivation, it's about making smart choices that nourish your body and keep your blood sugar levels stable. First things first, let's talk about what to load up on. Fiber-rich foods are your best friends. Think fruits, vegetables, whole grains, legumes. These guys are packed with nutrients and digest slowly, preventing those blood sugar spikes. Lean protein is another essential. Chicken, fish, beans, lentils, tofu. They keep you feeling full and help stabilize blood sugar levels. Plus, they're great for building and maintaining muscle mass. Healthy fats are crucial too. Don't be afraid of them. Avocados, nuts, seeds, olive oil, they provide energy, support heart health, and help you absorb those important fat-soluble vitamins. Now let's talk about what to limit. Sugary drinks are a big no-no. Sodas, juices, sweetened teas, they're loaded with sugar and can send your blood sugar levels soaring. Processed foods are another culprit. Think packaged snacks, fast food, frozen meals. They're often high in unhealthy fats, sodium, and added sugars, which can wreak havoc on your blood sugar control. Refined grains like white bread, white rice, and pastries are quickly digested and can cause blood sugar spikes. Opt for whole grains whenever possible. Let's talk about how to fight diabetes naturally, because prevention is always better than cure, right? And the good news is, there's a lot you can do to lower your risk through simple lifestyle changes. First up, let's get moving. Exercise is like magic for your body, especially when it comes to diabetes prevention. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And it doesn't have to be anything crazy. A brisk walk, a bike ride, a dance class, find something you enjoy and make it a part of your routine. Next, let's talk about stress. We all have it, but chronic stress can wreak havoc on your body, including messing with your blood sugar levels. So, find healthy ways to manage stress, whether it's meditation, yoga, spending time in nature, or listening to music. Now let's talk sleep. When you're sleep deprived, your body produces more of the stress hormone cortisol, which can increase your risk of insulin resistance. Aim for 7 to 8 hours of quality sleep every night to keep your blood sugar levels in check. And of course, we can't forget about weight management. If you're overweight or obese, losing even a small amount of weight can significantly reduce your risk of developing type 2 diabetes. Now let's talk about some natural supplements that might help. Always consult with your doctor before starting any new supplements, especially if you have any underlying health conditions or are taking medications. Cinnamon is a popular spice that has been shown to improve insulin sensitivity and lower blood sugar levels. Fenugreek is another herb that has been traditionally used to manage diabetes. It contains compounds that may help improve insulin secretion and glucose tolerance. Alpha-lipoic acid is an antioxidant that may help protect against nerve damage, a common complication of diabetes. All right, let's dive into some specific natural remedies that have shown promise in helping manage diabetes. Remember guys, these are not cures, but they can be used as part of a holistic approach to managing the condition. Number 1, cinnamon. This spice isn't just for your morning oatmeal. Studies suggest that cinnamon may help improve insulin sensitivity and lower blood sugar levels. Sprinkle some on your food or take a cinnamon supplement after consulting with your doctor. Number 2, fenugreek. This herb has been used for centuries in traditional medicine to manage diabetes. It contains compounds that may help improve insulin secretion and glucose tolerance. You can find fenugreek in seed form, as a powder, or in supplement form. Number 3, bitter melon. Don't let the name fool you. This vegetable packs a punch when it comes to blood sugar control. It contains compounds that act like insulin, helping your body use glucose more effectively. You can add bitter melon to stir fries, curries, or even juice it. Number 4, Gymnema sylvestre. This herb has been traditionally used in Ayurvedic medicine to help lower blood sugar levels. It's believed to work by reducing sugar absorption from the gut and increasing insulin production. You can find Gymnema sylvestre in supplement form. And number 5, aloe vera. Some studies suggest that aloe vera may help improve blood sugar control in people with diabetes. That's it for today's video on diabetes. We've covered a lot of ground, from symptoms and diagnosis to prevention and natural remedies. If you're concerned about your risk for diabetes or are experiencing any of the symptoms we discussed, please don't hesitate to reach out to a healthcare professional. Early detection and treatment are crucial in preventing complications down the line. Thanks for watching. Don't forget to give this video a thumbs up if you found it helpful. Subscribe to our channel for more health tips and share it with your friends and family. Take care and stay healthy.